I am talking to Dr. David Rabin, Medical Director, Cardiovascular Division at North Shore Physicians Group in Salem, Massachusetts. David is also my husband. Hi, David.
Hi.
David, we would like to talk about reopening the whole medical system. I know you're starting to have conversations about this with your practice and with the hospital, but let's start with why you're even beginning to have those conversations. What numbers are you seeing? How is the hospital responding that makes you believe you can even start the conversations?
Well, that's a great question because it's a process of planning. We had a plan. The beginning part of this thing, we sort of saw the surge coming, and we had to get systems in place to deal with the influx of patients. How we're going to manage them, where they're going to go, what teams of physicians are going to need to accommodate them. We need to also plan ahead to deal with the other side of this, because we are, as I've said to you, it looks like, looking at the numbers in Massachusetts and certainly at North Shore Medical Center, and I'm sure they're having the same conversations at Beth Israel Lahey and Tufts, that they're starting to see a decline in cases. And we've had a plateau, and once you start to see this sort of slow decline, and it takes much longer for the decline to occur than for the surge to occur. The surge goes like this. The decline is a very gradual sort of up and down kind of thing. But you got to start.
When you say decline, you mean a decline in hospitalizations, right?
Yeah, a decline in patients coming into the hospital. So we have fewer patients now at North Shore Medical Center than we did a week or two ago. And I'm sure that there are it's similar situations going on elsewhere. So once you start to see that, then you've got to say, okay, we've got to start thinking about what to do with all the stuff that we've been putting off. You have to realize that there are patients who've had elective or semi-elective surgery, colon cancers, brain tumors, cardiac catheterizations, open heart surgery. A lot of this stuff has been put on hold because we needed the beds and we needed the doctors and we needed the equipment. Now you got to start saying, okay, how are we going to start opening this up? And it's not going to happen. You can't just flick a switch and all of a sudden all your ORs are working and everybody's getting their colonoscopies and their cardiac. You got to figure out who's the most important that you get in first. And what kind of testing are you going to do first? Because you've got people, we have, and I'm just speaking in terms of my practice, we have echoes that we need to do and stress tests that we need to do. I'm sure there are colonoscopies that need to happen in the GI side of things. And how do you do that safely, both for patients and for the providers? We need to figure out what the appropriate PPE is for everybody. So when you're doing a stress test, what does the nurse have to wear? What does the tech have to wear? The patient has to have a mask. There's all these kind of things you got to think about. When you get an ultrasound of your heart, the echo tech is right up against the patient. There's no 6 feet, separation there. So you have to figure out how, what are the next ones that need to be done? How are you going to fit patients back into the office? Who are you going to see in the office? How are you going to safeguard the patients? What are you going to do in the waiting rooms? All this stuff has to be figured out. And we are just starting that roadmap. So there's a lot to consider.
So is the hospital or is your practice looking ahead and believing that the physicians in your practice and all the staff in your practice will need to be tested regularly? Because
I don't know. I don't know what we're all trying to figure out. Who gets tested? Do you test the patients? Should there be a point of care test when the patients come to the office? This is just thinking off the top of my head. I don't know. We haven't put in systems for this. Mm-hmm. So it's hard to know what kind of testing we're going to do, both on the patient side and the provider side, whether it's the clinical assistants, the nurses, the patient service representatives, the people that see you when you check in. What are we going to set up? And I think that's all in evolution. We're just, as I said, we had our first meeting last week.
Of the task force? The first meeting of the reopening task force.
Task force, yeah. We had our first conference, and we have another one Tuesday. I have a conference tomorrow with somebody talking about stress testing. How are we going to do that? And each specialty and each practice has to figure out how they're going to do that. And we are in the nascent stages of that. There's a lot of stuff that we have to consider.
So could you just mention, I realize it's very global at this point, but what were the main 2 points that came out of that first meeting of the reopening task force?
I would say who has to be seen? What patients in one of the questions that they asked is what patients in your specialty, in your group, what are the top 5 diagnoses that you think need to come in? Who do you need to see? And cardiology sort of ranks them. They're for example, heart failure, severe valve disease, certain arrhythmias, chest pain, coronary, like angina, those kinds of patients need to be seen. There are other patients that are perhaps can be put later on, and I'm sure that there are patients in a gastroenterology practice and a pulmonary practice that they say, okay, we need to see these people, and the primary care say we need to see these people. So I would say, who do you have to get in your practice? And then on the hospital side and the testing side, who do you have to test? Who do you have to start testing?
All right. So what have those patients been doing up until now? I mean,
they've been sitting tight.
So
they've been sitting tight, I've got a gentleman with aortic stenosis, and we've been sort of dealing with a little bit of diuretics and keeping him going. There are patients out there with, as I mentioned, colon cancer, who are waiting for their surgeries. And I'm sure every doctor has his or her stories of people that they're sort of managing from afar and then trying to get them in so that they can ultimately get what they need done.
Well, anything else you think that would be interesting for people to know about the issues around reopening the medical community?
Well, I think the things that patients need to know is that, one, we're thinking about it, which is a nice thing to know. Number 2, that it's going to be done in an organized fashion so that they are safe, so that they don't have to worry that somebody is going to be sitting in the waiting room. They're not going to be in a packed waiting room, and that they will get the care they need. So I think those are the messages, that we're thinking about it, that it's out there. It's going to be a slow process. It's going to be a careful process, and it's going to be a safe process. I think that's what you got to know.
Thank you very much.
You're welcome. See you soon.
Okay, bye. We'll talk again, right? When this reopening task force keeps going. You'll keep us.
I'll let you know. You
okay.
bet.
Bye.
Bye-bye.